Mental health problems and illnesses, just while everybody recognizes that they're an important issue in our society, and while there's been more and more attention paid to it, it still hasn't kind of reached that tipping point where it's recognized as enough of a priority to address in a meaningful, sustained, and significant way. Basically, you've got this sort of silos, right, where you have the correctional mental health services, and then you have civil mental health services. And because people go in and out of prison, it creates problems for continuity of care when they're not integrated. But there's also a governance issue. There's this opportunity to try to bring these systems together more. Of course, in Canada, it's uniquely complicated because of the provincial and federal jurisdictional issues around health. So there's some additional challenges to that, but there's still potential.
You know, I think at the end of the day, it does come, as bad as it sounds, it does come down to money and who can fund what and where the money gets distributed. But I think it comes down to really the systematic, navigating the systematic levels of federal and how does that translate to provincial. We're spending so much money on warehousing people with mental health issues in a jail, and that money could be actually spent on prevention, big time. My passion was always court and criminal justice related stuff. I'm very passionate about mental health, but when you add the criminal justice component to it, it is like a whole another level, and that's what I think I got extremely interested. Like it's just fascinating to me. There's a very high prevalence of our clientele being in a criminal justice system. That's just given. They're going to look at the crime, they're going to look at the protection of the public, but nobody really is looking at, does this client has a mental health issues or not, right? Like if we're in a hospital, you have somewhat of a triage. In criminal justice system, you don't almost have that triage, and police becomes that triage. But at the same time, police doesn't have a time, or they're not trained to identify these people. And it's kind of a problem because we don't know who is almost in our jails. Police is really revamping their ways of and have a really solid, I would say solid mental health training now, at least to that they're training all of their frontline officers in.
My name is Ritchie Laperle. I was born in 1992, December 23rd. Around 6 and 7, I was having family issues, abusive family. Mom died when I was 3. I only had my father left, so he was an oxy head and he ran away, disappeared. My mother took care of me. So between 6 and 7, I was in and out of group homes. And then after that, they tried to let me free to back to my grandma's at 11. I was still in mental problems. I went back into care, got Crown Ward. Became a group home kid, became traveling everywhere, AWOLing, violence, drugs, peer pressure. So that just everything in my life went spiral. Everything, I was non-listening, I was defiant, I was out of control. So once I got out of control, I started getting bad habits, and that's when I ended up in jail. I felt very secure, I felt safe, because they wanted to more help me for me and to actually be there for my problems. So I actually like that, to actually feel like I'm comfortable, I can talk to somebody. And then I met Dasa. So since I've had Dasa, it's going good for the last 2 years. I've been actually very proud that she's really straightforward. And that's what I like about the workers here, because they feel if they're working with you and they see a program or an opening, they'll ask you about it, tell you about it, and ask you, do you want me to ask if you want to get involved? And that's the one thing I like, because there's most workers that are like, oh, here's this paperwork, here's a whole bunch of paperwork, read it yourself and figure out what you want to do. What we want to do is give her a family that we didn't have. We didn't have mom and dad, we were in a group home, both of us were in a group home, so we've lived the life, and now we want to give a better life for our daughter. So every single day, what keeps me happy is my daughter.
if people think that putting people in jail with people with mental health, because that's what we're talking about, is a solution, that something's going to happen there and they can tackle their issues there, they're absolutely wrong. Because we're basically trying to throw them in a jail to tackle the situations and things that got them in a jail in the first place, right? So it's like, what are we doing here? There's certainly a lot of innovative ways that we're trying to address the gaps in a system. But, when we look at the big picture, should it be a big picture federal level kind of initiative? Absolutely. And I really believe it is at this point. Maybe it wasn't in the past, but I believe this government is really have that on their radar, and there will be changes coming.